Hi everyone. Have you ever wondered why am I still getting recurrent kidney stones even after surgery? You are not alone. And today we are diving deep into this frustrating reality that the science behind the stone recurrence and what you can do to prevent it. Now let's get real. Surgery removes the stone, not the stone making factory inside your body. Think of a surgery like cutting down weeds from your garden. If you don't change the soil, the weeds grow back again and again. So recent studies, including 2024 meta-analysis published in the Journal of Urology Advances, reveals that around 35 to 50% of the patients can develop a recurrent stone within the first 5 years of having surgery, especially if no preventive measures were taken. Most of the patients feel the job is done after whether PCNL or the RIRS or ureteroscopy and skip the next crucial step, that is metabolic evaluations, dietary corrections and the follow-up protocol. Let's look at the science. Why do these stones come back again and again? High oxalate level, low urinary citrate level, dehydration, that is lack of water, genetic predispositions, which is very important, and underlying conditions like medical conditions like hyperparathyroidism or metabolic syndrome. A breakthrough study in 2025 from the International Nephrolithiasis Consortium tracked around 3,000 patients post-surgery. Shockingly, 70% of these recurrent cases have at least one preventable factors like low fluid intake or high dietary sodium. It is not just your bad luck, it is all about biochemistry. If your urine stays super saturated with the stone forming salts, stone will return no matter how successful the surgery was. So let's talk about the biggest post-op blunders. Skipping the 24-hour urine test, which tell us exactly what are your stone risk is. Going back to high protein, low carb diet, fat diets, assuming that drinking any fluids including soda or sweetened juices is enough for hydrations, not checking supplements like vitamin D, calcium, oxalate boosters in your gym powder. Here is what most people don't know about. 70% of the recurrence could be avoided with a personalized dietary and metabolic intervention. That is not a guess. That's a 2024 finding from the European Urolithiasis Study Group. So what can you do? The first thing first, stay hydrated. Aim for 2.5 to 3 liters of water per day, more in the hot and humid climate. Follow the stain-specific diet, lower the salt, moderate animal protein, high in fruits and vegetables. And at least get a metabolic workup, urine and the blood test to tailor your prevention strategy. Regular ultrasound and CT checkups are required because a small recurrent stone can stay silent. And yes, consult your urologist every year, even if you feel fine. Now the prevention is cheaper, less painful than any other subsequent surgeries. Remember, surgery is not just the beginning. If you don't change the internal environment of your body, the stone will find their way back. Like this video, found it helpful, drop your questions or experience in the comment sections. And if you or your loved one has recurrent stone, reach out to us at the Center for Advanced Urology and Renal Transplant. We help you stay stone free and not just stone cleared. Thanks.